Hello, and welcome to another edition of A Successful Transition from Monogamy to Open. And last week we started talking about the issues of erectile dysfunction problems. I don't really like the word dysfunction because I think it sounds so bad. And so I usually tend to use the term erection difficulties because it's something that happens to everyone at some point or another. And so the embarrassment about it, we need to learn to get over that and accept that it happens, and it happens for a variety of reasons. And so this week, we're going to split it up and talk about the three basic areas that tend to cause erection difficulties. It's the physiological problems, it's the psychological problems, and it's the hormonal problems. And depending on which it is, there usually are different symptoms and definitely different medical providers you want to see for help with it. Because going to the wrong people for too long is a waste of time and money and frustration. And it's just much easier if you go to the right person to start off with. So today we're going to talk about physiological issues. Now, physiological issues really relate to the lack of blood flow to the penis related to health and lifestyle choices most of the time. So it's things like the cardiovascular issues, so high blood pressure, and especially the medications that most people are on for high blood pressure can cause a lot of erection difficulties. It's high cholesterol and the resulting medications that people are on, especially if you have diabetes. Diabetes can really cause problems with erection issues. If there's a long history of smoking, smoking causes plaque to build up in the arteries. If there's excessive weight gain, excessive alcohol use, or real lack of physical exercise, all of these things can cause erection issues that are more of a physical cause. Usually with this, because of the buildup, that you want to really look at the lifestyle issues. So this is the stuff where generally you're going to go to your typical medical doctor, your nurse practitioner, whoever you see for your general medical care. They're usually going to be a good source of that because you need to think about things like stopping smoking. You need to work on your diet, exercise, lose weight, limit the amount of alcohol. All of those things are going to help when you're talking about a physiological issue. And the treatment modalities are the things like the common things that most of us know about and think of. The Viagra medication, the Cialis, the Levitra. It can also help if you're making medication changes to your high blood pressure or your cholesterol medication, because some of them are more likely to cause erectile difficulties and there are others that are less likely to. And then also, if once those medications stop working, and particularly if you're not making enough lifestyle changes to make a difference, then you're going to end up looking at other medications that are more advanced, things like penile injections or even all the way up to penile implants. Now, recently, there's also a newer treatment called shock or sound wave therapy. Different places call it different things. And it's a treatment where they use these wave therapy wands to kind of break up some of the plaque in the penis that's started in the arteries. It can help regenerate nerves, open up the arteries more, and it's seeing very good results. Now, that's something that you're not going to go to your general practitioner for. That's something you're going to need to go to a urologist for, because generally it's urologists who use the wave therapy rather than general practitioners. Also the problem with the wave therapy is that it's not covered by insurance. So it is a bit expensive. And so if money is a factor for you, you're probably going to have to go with more of the more traditional treatments like Viagra, Cialis. And definitely talk to your doctor, because if they are physiological issues, especially if they are cardiac issues, the nice thing about getting in and getting that treatment is sometimes the erectile issues are the first sign that you're having cardiac problems and you're having blockage of your arteries, because clearly the arteries that feed the penis are smaller than the arteries that are around your heart. And so if you're starting to have blockage, you're going to notice it in those smaller arteries first. So it can be a good way of realizing that you're having cardiac problems, even if you think you wouldn't be at high risk for them. So it is a good idea to get into the doctor and have that checked out to see if there are any cardiac vein issues going on. I'm sorry, artery issues going on. So the other thing that can be a physiological problem is what's called venal leakage. So the way the basic mechanism of erections work is that the blood comes into the penis through the veins, and then the little flaps on the veins, I think I said that wrong. They come in through the arteries, and then the little flaps on the veins shut down when the erection process starts. So it keeps the blood in the penis. And that's what causes, and that's why men who are young have those nice, really firm erections, because those veins still have pretty strong flaps that close down. All the structures work really well, and you get those nice, strong erections that men talk about as they age. They're like, oh, it's not as firm as it used to be. That's a lot of times caused by venal leakage, is because those little flaps start to age, and unfortunately we don't have replacement parts for us. So you can't just go get those little flaps replaced. Now there are things you can do medically to treat that, depending on the severity of it. Sometimes things like Levitra, Viagra, Cialis will help because you're just getting extra blood in. You're still leaking some out, but you're getting more in. So that can help for some men. Some will use a cock ring that goes around the penis and the testicles that then kind of blocks off those veins that tend to be more on the top side of the penis. And so that will then help to keep a nice firm erection. And in real severe cases, sometimes people have to do the penile implants. So that's all for today on the physiological issues. And like I said, this is where you're going to usually go to your general practitioner, your general medical doctor, unless you want the shock sound wave therapy, and usually then you're going to need to go to a urologist. On Wednesday, we will talk about the hormonal problems. And then on Friday, we're going to talk about psychological problems. So thanks for joining me, and have a great week. Bye.